Welcome again to Dr. Sourik's class. Hello all the students who are interested in the Organon of Medicine. I would like to deliver a lecture on aphorism number 4, and keeping in mind the for the newcomers, for the particularly the first and second year students, I will like to discuss this aphorism number 4 in a very simple and easy language. So let us start with aphorism number 4. We see that in the beginning of the Organon of Medicine, when you start from aphorism number 1, we see that aphorism number 1 is mission of the physician, which is the restoration of the sick to health, which we call cure. Now how this cure what we can say, the what type of thing is this cure, that is the highest ideal of cure, it is given in aphorism number 2. If we see that to make this cure or to make this cure happen, what a physician requires to know, he requires some special knowledge. So that is called the requisite knowledge of the physician. It is written in aphorism number 3, and the continuation here in aphorism number 4. This is also another knowledge of the physician, which we can see in this aphorism number 4, and another knowledge we see in aphorism number 6. Now when we are talking about aphorism number 4, this aphorism number 4, we can say that it is a part. If we see that if we divide this aphorisms, that is 1, 2, 3 and 4, these 4 aphorisms are regarding the physician. First of all, we see that the physician's mission, the ideal cure, which is also regarding our knowledge of the physician, the 3, that is completely knowledge of the physician, and aphorism number 4, what you can say that the title of aphorism number 4 is the preserver of health. Yes, the preserver of health. Obviously we see that the physician is the preserver of health, and this aphorism number 4, this is also, we can say that it is also a part of the knowledge of the physician, that is the physician must know how to preserve the health. Now preserving the health, it relates somewhat to the prevention, we can say, regarding the prophylaxis, or how he can protect the person from unhealthy situations or diseases. So protection of the diseases or the prevention of the diseases, we can say, this is indicated in aphorism number 4. So first of all we can read this aphorism number 4. So aphorism number 4, it is written that he is likewise a preserver of health if he knows the things that derange health and cause disease, and how to remove them from persons in health. That means that first of all, you see, it is just a one line aphorism, and it is written here that he is like a preserver of health if he knows all the things that derange health, if he knows all the things which can cause disease, and if he has the knowledge of keeping all these things away, away from a healthy person, so that the person or the patient or whatever, we cannot say this in this aphorism number 4, we cannot say it as a patient, because a patient is a person who is already diseased. Here we are talking about the persons in health. That is the point number 3 in this preserver of health, that if the physician, he has the knowledge to how to keep the person safe from all these things which derange the health or cause the disease. So just going through some sort of explanation of aphorism number 4. First of all, when we read this aphorism number 4, just read that he is likewise a preserver of health. Now what I would like to say, that in many reference books, just before going to the part by part explanation of aphorism number 4, I would like to tell all the students that in some reference book, qualification of physician has been chapterized. That means that it has been titled as qualification of physician, and there is a mixing up of aphorism number 3, 4 and 6, as because in these 3 aphorisms, aphorism number 3, 4 and 6, there are all the things which we can take as a qualification of a physician. but it is correct, it is not bad. It is written in many reference books in such a manner, and you students can prepare this as a requisite qualification of physician as a topic, and you go through this all these three aphorisms together. But when you are reading aphorism number 4, you must read aphorism number 4 in a separate manner. So there is a separate identity of aphorism number 4. Otherwise, you see that Hahnemann would not have been divided aphorism number 3, 4. He will write a single aphorism of 3. So when we are going with aphorism number 4, the title of aphorism number 4 is Preserver of Health. First of all, okay, Preserver of Health. Now, who is a preserver of health? What do you mean by the preserver of health? I have just now explained that he who preserves the health. Now, preserving means to maintain, to keep, or we can say to protect, to keep it in a normal condition. So that is called a preserve. So we preserve the things. So as well as we consider the physician must have the knowledge to preserve the health of all the people. So regarding this thing, we can see that there is nothing in aphorism number 4 regarding the sick. There is the thing which regarding which indicates the prevention or preserving of health. Okay. Now, coming from the beginning, we see he is likewise a preserver of health. So you know the meaning of preserver of health. Now he is likewise a preserver of health. What does it mean? Likewise means that there are other preserver of health also. Who are those other preserver of health? Obviously, when we are reading the aphorism 1, 2, 3, 4, we are going with the physician, qualification of physician. Obviously, the word he here indicates the physician. Now, the physician is likewise a preserver of health. That means that the physician is like a preserver of health. So, there is another question here. Who else is the preserver of health other than the physician? Who else is the preserver of health other than the physician? So, where from we get the answer? Obviously, Dr. Hahnemann will give us the answer. Okay. So, if we go to aphorism number 10, first of all, if we go to aphorism number 10, we can see that without the vital force, the body has no sensation, no function, no self-preservation. This is given in aphorism number 10. So here in aphorism number 10, we are seeing that without the vital force, the body is capable of no self-preservation. That means that the body is not having any self-preserving power. So without the vital force, so the vital force is having a preserving power. We can say that point number 1, other than the physician, the vital force is the preserver of health. This is one point. Okay. Again, if we come to aphorism number 14, there it is written in a gist. I can tell you that it is written that there is no disease in this world which does not produce any symptom. Alternately, we can say that it is telling in aphorism number 14 that each and every disease in this world produces some symptoms, obviously produces some symptoms, and this is a system, of nature, or this is a system which is we can say that it is done by the infinite goodness of the all-wise preserver of human life. It is the infinite goodness of all-wise preserver of human life which is indicate the God, the Almighty. So there is all-wise preserver of human life, the God. So we are getting that another preserver of health, that is the God, from aphorism number 14. So when we are telling about the preserver of health, he is likewise a preserver of health. That means the physician is likewise a preserver of health. He is like a preserver of health. That is there are other preserver of health also. One is the vital force and one is God. So the physician is also, he is likewise a preserver of health. Now how he is a preserver of health? We can now divide this aphorism into three points. That is, if he knows the things that derange health. Point number 1, if he knows the things that derange health. So the physician must have some knowledge of what are the things that derange the health? It may be some hygienic condition, the untidiness which can cause or derange the health, the stressful condition which can cause the derangement of the health, and these are, and the list goes on. So the physician must know all these things which can derange the health. Now we can give some example regarding that. Suppose that in today's scenario, the physicians are telling that there should not be any stagnant water in any locality because it increases the mosquito reproduction, and there is chances of increase of malaria. So this is our knowledge which can derange the health. Now the stagnant water can increase malaria. Who have studied? The physician have studied all these things, the life cycle of the mosquito, of the Plasmodium vivax, and we can see that malaria can cause, this is the causative agent of the Plasmodium vivax. Okay, so the malaria, and the physician is also knowing that if there is any stagnant water, it is increasing this thing. So this is one example that physician knows the things that derange health. Obviously the Plasmodium vivax is not the ultimate cause of malaria, the ultimate cause is the derangement of the vital force, but these are the agent which can cause the disease. So there is a difference between the cause and there is a difference of the agent. So we will discuss it in the cause of the disease in the next aphorism, aphorism number 5. For this aphorism, for explanation of aphorism number 4, we are giving this example that the physician has the knowledge of things that derange the health. So there are many other examples which we can give regarding the things that derange the health. Next point is the things that cause disease. Derange health and cause disease. See, it is written. So things that cause disease. Things that cause disease, that means the physicians must have a clear-cut idea about the disease causation. If the physician are not having the proper idea regarding the disease causation or the cause of the disease, exactly what are the cause of the disease, then he might not be able to cure the disease completely. If we go to aphorism number 5, we'll go in a detailed explanation in a separate lecture, but we can see that Hahnemann has divided the cause of the disease into 3 basic causes: the exciting cause for acute disease, the fundamental cause for chronic disease, and another cause is the maintaining cause, which is both applicable for the acute and the chronic disease. So these causes and the examples of these causes, and what we can say that the study regarding the cause of the fundamental cause, the chronic miasm, etc., etc., all these should be kept in the knowledge of the physician properly. And if he knows all these causes, not only these this type of things, that the fundamental cause, the miasms, etc., the exciting cause which can cause many type of diseases. So these are all the things which can cause the disease, and the physician must know regarding these causes. Now coming to the third point, and how to remove them from the persons in health. We must note the word, the persons in health, that is a healthy person, and the physician, he is having the responsibility to preserve his health. So he must have the knowledge of how to keep all these causative agents and all these things which can cause the derangement of the health, how to keep away all these things from the persons. So there are a lot of things or the lot of advices. We can see that in today's system of medicine, there are many awareness regarding the health. Just we can give the example of COVID, very common examples, that how the people can be kept healthy by keeping the safe distance, by washing the hands, by avoiding the touch in the eyes and the nose, to be careful of wearing the mask, etc., etc. These are all the advices given by the physician to keep the person healthy, to keep in health. Very common example and very easy example to make you understand. So this is in a nutshell aphorism number 4, where we can see that if we just have a very short discussion on aphorism number 4. First of all, what is aphorism number 4? It is a preserver of health. What is the how can the physician be the preserver of health? There are three main points. One is, if the physician knows the things that derange health. Point number 2, if the physician knows things that cause disease. And last point number 3 is the, if the physician knows how to remove them from the persons in health. Okay, so these are the three main points, and I have just given you examples and explanation of aphorism number 4. So next, what it is the it is a slide of aphorism number 4. Okay, you can take the screenshot. Now, regarding the appendix of aphorism number 4, this is one extra of this lecture, that is this aphorism in the first 4 editions, 2 paragraphs come in here, and exactly what is written in just one line in the 5th edition, it is not show in the first to 4th edition. And we can see, we do not for the second year, the first year students, we do not go to a very details of this. Just we can see that we are getting some 5 and 6 aphorisms in this editions from 1 to 4, and that is completely changed in the 5th edition, and you will read the 5th edition, which is just given the preserver of health in one single line. So this is the appendix, which is telling that in the last 4 editions, this aphorism number 4 was not like this. It was like what is written here in the as per aphorism number 5 and 6 in these conditions. Now, questions on aphorism number 4, we can see this question: who is the preserver of health? Answer is, the physician is the preserver of health, and other than the physician, as per Hahnemann's Organon, we get the vital force and the god as the preserver of health. Next, what is the role of preserver of health? Now, the role of preserver of health is to protect the persons from unhealthy conditions and disease, or we can say that the role of preserver of health is to preserve the health or prevent the disease. Okay. Next question: describe an aphorism which indicates health prevention. Now, so this is the aphorism number 4, which is indicating the health prevention. And regarding another word which is used commonly as the prophylaxis, describe an aphorism which is indicating the prophylactic diseases. So there are other examples on prophylaxis which is given in the footnote of aphorism number 33, and which is given in the footnote of aphorism number 73, where Hahnemann has described about belladonna in scarlet fever and aconite in purpura, which is used as the preventive medicines in as per homeopathic preventive medicine in these diseases. So these are the separate aphorisms, footnote regarding prophylaxis and the preventions in an overall prevention of disease. This is aphorism number 4. So if there is any type of question regarding explain aphorism number 4, just we have discussed, just you break this aphorism number 4 into 3 parts and explain one point separately. Okay, so thank you. We'll meet in the next. Just we are going with the series of aphorisms one after another, and it is for all students throughout India and abroad. So I am giving this lecture in completely in English, so that the students of abroad can also follow if they wish to. Thank you. We will meet again.